Welcome to this virtual presentation about the feasibility of the SOCAV in primary care program. This study had a qualitative-driven mixed method design, and data was collected among focus groups, in-depth interviews, diaries, and questionnaires. Let me start with a brief introduction about the SOCAV intervention. The aim of the intervention is to support persons with dementia and their caregivers to maintain or improve their self-reliance, daily functioning and meaningful activities, and quality of life. The SOCAV intervention is based on the principles of the Community Occupational Therapy in Dementia program and on the Colorama Self-Management Training and Coaching Program for nurses. It consists of a training for nurses and informal caregivers, 3 meetings each. The training focuses on providing knowledge about dementia, person-centered communication, and observation strategies. After the training, the nurse participates in an ongoing reflective coaching program by a SOCAV coach. This consists of 4 consecutive rounds spread over a period of 6 months. Each round has 2 individual coaching sessions and 1 group session. During the individual coaching sessions, the nurse is asked to reflect on their own behavior through the 3 questions mentioned on the PowerPoint. During this coaching phase, nurses will get familiar with observe, act, observe. First, the nurse observes the behavior, situation, strategies, and needs of the person with dementia. Second, the nurse chooses an action based on the observation. And finally, the nurse observes again after the action towards the person with dementia. Based on our previous design feasibility study presented on a conference last year, we introduced SOCAV group meetings at home to support implementation. This meeting involves the person with dementia, the informal caregiver, and the nurse. They are supported by the SOCAV coach in exploring wishes and goals, as well as providing alignment in ways to support self-reliance. I would like to highlight some of the results of this feasibility study based on the aspects of Bowen. As for acceptability, we observed at the start of the intervention, nurses were unfamiliar with reflective coaching. This led to some resistance at the start of the coaching. However, an early start and ongoing coaching with a variation between individual and group meetings worked as a facilitator. The nurses felt more confident with the coaching method and their attitudes and skills started to change. Another barrier nurses experienced is the individualistic way of working in primary care. Nevertheless, working on their own also gave the nurses the confidence to experiment with their new way of working without being observed by their colleagues. Finally, we've seen the nurses being more aware of their own actions, which was tailored to the client's wishes. When we zoom into the informal caregivers, we saw some barriers in the concept of self-reliance. The meaning and interpretation of the concept differed between participants. Informal caregivers often thought they do a lot to support the self-reliance, but actually gave more guiding or even convincing advices to the person with dementia. Although later than expected, due to COVID, we were able to provide the informal caregiver training to some informal caregivers, and which helped to gain knowledge about dementia, but also understanding how to support their loved ones. This was supported by the SOCAV group meetings in really finding a way how to give meaning to self-reliance and finding the shared problem with each other. The SOCAV group meetings were performed at home and was planned every 2 weeks for a short evaluation. However, almost all of our participating informal caregivers were sons and daughters, which did not live under the same roof. This made the 2-weekly evaluation more difficult to organize and more time-consuming for the informal caregiver. Interestingly, we found an important result related to efficacy. We also saw the informal caregivers listening more to the wishes of the person with dementia, and some even being more reflective towards their own actions and questions they asked towards the person with dementia. So, what do you want? Thank you for listening. And if you have any questions, please don't hesitate to contact me.